Vermont Senator and Democratic presidential candidate Bernie Sanders is in the hospital right now after undergoing a heart procedure. According to his campaign, Sanders experienced chest discomfort during a campaign event yesterday, and a medical evaluation discovered a blockage in one of his arteries. 2 stents were inserted, and he is now resting comfortably. All of his events and appearances have been canceled until further notice. For more on this procedure and exactly what was done here, we're joined in studio by KTVU medical expert Dr. Larry Burchett. We appreciate you coming in. Yeah, thank you so much. Let's start off by reminding everyone what a stent is, what it does, and explain how this procedure works.
So they went in and found that Bernie Sanders had a blocked artery in his heart. You go in, I was just showing you right here. You go in through your wrist, up through there, squirt some dye, and you can see there's a blockage. They open it with a balloon, that's angioplasty, and then they leave this little metal tube in there called a stent to keep it open. So now Bernie has this stent that allows blood to continue to flow to his heart. This is not open heart surgery. The recovery time is incredibly quick. Some people go back to work the next day. I wouldn't advise that for him, given the stress of campaign and so forth, but...
Yeah. Well, how, in the grand scheme, a lot of people get these stents. A lot of people have blockages in their arteries. How big a deal is this, do you think, for Senator Sanders?
There's political implications of this that...
Sure. Let's just take it from a health standpoint for now.
Yeah.
How serious do you think this is?
Well, so heart disease is the #1 killer of both men and women. There's risk factors for this, including diabetes, high blood pressure. Once you have coronary artery disease or blockages in the heart, that confers another layer of risk that he's going to have to be on medication, be monitored. That said, his artery's open. His blood is getting, his heart is getting blood flow. And again, there's a lot of things we don't know. Did he actually suffer a heart attack?
Yeah.
Is his heart beating normally, or was part of it permanently damaged and it can't beat normally? I don't know. I can't tell from, the information that we have. That would be a big difference. Somebody could have some chest discomfort, get a stent, open everything up, and be relatively fine.
And he was said to be feeling a lot better. I mean, once he had the stents, the 2 stents put in, he was said to be feeling good, breathing easier, and maybe not ready to get back out there on the campaign trail. That raises the broader questions here. When you have someone who is running for president, that puts a lot of stress on you. I mean, those are long days. It's a lot of travel. What is the likelihood, do you think, that Senator Sanders is going to be back out there on the campaign trail with a rigorous schedule anytime soon?
That's going to be a question for him and his doctor. You're right. Stress does affect the body and the heart. When you're stressed, adrenaline is released in the system, and that affects the heart to both contract deeper, stronger, and faster. And so his doctors are going to want to make sure that his heart is able to handle the stress of the campaign trail.
How long do you think he is in the hospital and resting, you think? What's the
recovery? I would say recovery for these things are typically, you would advise a week or 2. It's not open heart surgery, right? That's weeks of recovery. You're in the hospital. Some people go back the next day. What's he going to do? I don't know. That's a conversation between him and his doctor, and we'll see.
And potentially with him and his campaign, his strategist as well, because that obviously plays into it. But hopefully, obviously, his health comes first, and we wish him all the best in his recovery.
Yeah, I'm glad that they caught it. He went in appropriately when he had the symptoms of a blockage in his heart and heart disease, and he got it taken care of.
And maybe a reminder for other folks out there as well.
Yeah, exactly.
Keep an eye out for those symptoms. All right, Dr. Larry Burchett, always appreciate you coming in.
Yeah, thanks for having me.
Thanks so much.